Welcome to this educational program. This module discusses the indications or reasons for requiring a type of eye surgery called vitrectomy. Other modules are available that describe other aspects of eye health. This information is taken from a recent review of the medical literature and attempts to be as transparent and comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Before discussing the details of vitrectomy, it is important to understand some basic anatomy of the eye. This illustration shows a side view of a normal eye. At the front of the eye is the cornea, the window of the eye that lets in light. Behind the cornea is the iris, the colored part of the eye that regulates light. Behind the iris is the lens, a flexible structure in the eye that focuses light. And at the back of the eye is the retina, a 10-layered membrane that receives light, forms that light into images, and sends those images to the brain, enabling us to see. Filling the eyeball from behind the lens to the retina is the vitreous humor, a gelatinous, transparent fluid composed of water, collagen fibers, and various other molecules. It gives the eye its form and shape, prevents the eyeball from collapsing, and is a pathway for nutrients and light. In a young healthy eye, the collagen fibers of the vitreous are attached firmly to the innermost layer of the retina. Over time, though, as we age or experience eye disease, the vitreous liquefies, shrinks, and pulls away from the retina. In most cases, this vitreous separation, called posterior vitreous detachment, or PVD for short, is a clean break and occurs without any negative effect. Other times, however, part of the vitreous remains attached, and its traction or pulling force on the retina can cause damage. A vitrectomy, also called trans-pars plana vitrectomy, or TPPV, or pars plana vitrectomy, or PPV, is an eye surgery that removes the vitreous in order to test it for disease, clear it of debris, relieve its traction on the retina, or access areas behind it. In a vitrectomy, the vitreous gel is cut, suctioned out, and replaced with another fluid. First, using a microscope and special lenses designed to see the back of the eye, the surgeon makes 3 tiny incisions in the white of the eye and passes a very small instrument through each of them. The instruments include a light source, a cutting and suctioning tool called a vitrector, and an infusion port to put fluid through. Some of the most common eye conditions that require vitrectomy are diabetic retinopathy, a complication of diabetes that damages tiny blood vessels in the retina, retinal tear, which is a break in the retina often caused by vitreous detachment, retinal detachment, the separation of layers of the retina or the peeling of the retina from the back of the wall of the eye, macular hole, which is a hole in the center of the retina caused by injury, disease, inflammation, or vitreous detachment, and macular pucker, scar tissue on the retina that causes distorted vision. Diabetic retinopathy is a complication of diabetes that damages the tiny blood vessels in the retina, depriving it of blood supply and proper nourishment. The new blood vessels that grow in response are abnormal and weak and cause severe vision loss when they rupture and bleed. A vitrectomy will remove any blood that has seeped into the vitreous and will also provide access to the retina for repair. A retinal tear is a split in the retina caused by vitreous traction, eye injury, or retinal degeneration. Tears tend to be more common in nearsighted people, as a longer than average eyeball usually means a thinner, more fragile retina. Tears are a significant concern, for any fluid that seeps through the tear can initiate retinal detachment. Permanent vision loss can occur. A giant retinal tear is at least as big as a quarter of the retinal circumference, and a horseshoe retinal tear is named for the shape of its flap. Retinal detachment is the separation of the layers of the retina or the pulling loose of the retina from the back of the eye. It can be caused by fluid seeping through a retinal tear, injury, traction from the vitreous during detachment, and traction from scar tissue on the surface of the retina. Retinal detachment requires immediate medical attention and surgery, as it can cause devastating vision damage if left untreated. A vitrectomy will expose the retina in order to reach and repair a retinal tear or detachment. A macular hole is a hole in the macula, the area at the center of the retina responsible for sharp, colored, detailed, straight-ahead vision. Treatment involves first removing the vitreous and then placing a gas bubble in its empty cavity that will press against the macula and close the hole. A macular pucker is a thin layer of scar tissue on the surface of the retina that forms in response to retinal damage. The pucker pulls on the retina and distorts vision, which in most cases is slow and mild. For more severe cases, though, a vitrectomy is required, after which the surgeon can access the retina and gently peel and remove the scar tissue from its surface. Macular pucker is also known as epiretinal membrane, surface wrinkling retinopathy, cellophane retinopathy, or internal limiting membrane disease. Finally, phenomena that are normally harmless but that can indicate retinal damage are floaters and flashes, the dots, spots, lines, or webs that appear suspended in your vision and move along with your eye, and the occasional flash of light. If you have started to see floaters and flashes, or if you have noticed a change or increase in their frequency, please see your eye doctor. An eye exam can rule out the possibility of retinal damage. A vitrectomy is a surgery that removes and replaces the vitreous so that vision can be corrected. Indications for vitrectomy include diabetic retinopathy, retinal tear, retinal detachment, macular hole, and macular pucker. A vitrectomy clears away the vitreous in order to access the retina for repair. Here are just a few of many resources available to educate you on eye health, eye disease, and vitrectomy. These resources may also assist you. We sincerely hope that this module has furthered your understanding of the indications for vitrectomy. We wish you the best for the future, and thank you once again for viewing this educational program.